In this video today, we're going to talk about parasites. Not everyone's most favorite topic, but a lot of people come to me and say, I think I've got parasites, I've got digestion problems, I'm seeing strange things in my poop. But how do you know if you really have one or if it's something else going on? In this video, we're going to look at the best ways to test for parasites, signs and symptoms, and some remedies to help you get rid of parasites if that's part of the issue. I'm Michael from Planet Naturopath, and I help people do more advanced functional medicine testing to help get to the root cause of your health issue so you can get your health back on track. So let's talk about parasites. A lot of people can have different types of parasites and not even know about it. Parasites like Blastocystis, Hominis, 𝗦𝗪𝗡𝗎𝗪 fragilis, they're always come up with weird names for them, like Entamoeba, Histolytica. Anyway, these parasites can be common parts of our ecosystem these days. I'll often see low levels of these parasites in tests like the GI map or the 𝗪𝗞𝗀𝗻𝗂. Whether you need to treat them or not, and the best way to treat them, it's going to depend on the results, the levels of parasites, and also your signs and symptoms, and what else is going on with your gut microbiome. Parasites are more common than you think. And they're not just parasites or bugs that you pick up in third world countries or on holiday in Mexico or Bali or something like that. But people travel everywhere these days, and these parasites are almost part of our ecosystem. But certain parasites like Giardia or Entamoeba histolytica, you should have zero levels of, and you want to treat these absolutely. But there's other ones like the Entamoeba or Blastocystis that may or may not be a problem. So here are some of the telltale signs of a parasite infection. And this is more important, especially if you've been on holidays, you've gone somewhere, and these symptoms have come out of the blue. Symptoms like watery, foul-smelling diarrhea, fatigue, or just general malaise, abdominal cramps, bloating, gas or flatulence, excessive amounts anyway, nausea, unexplained light weight loss. These are all symptoms potentially of a parasite infection. Of course, it could be caused by other things too. It could be a bacterial infection, a viral infection of the gut. Plus, when you get a parasite infection, it's often because the gut is already out of balance or the ecosystem is out of balance already, so lacking of the beneficial bacteria or having other high levels of opportunistic bacteria. So sometimes when you're treating an infection, you're not just treating parasites, and you may have to build up the good guys and create a better environment for the beneficial bacteria. And this can sometimes then is all you need to get rid of the parasites. Parasites love an alkaline environment. People talk about acid alkaline diets and being alkaline as being healthy. But with your gut health, it's different. Your stomach should be very acidic. The small intestine is not quite as acidic as the stomach, but still acidic. And the large intestine still has a pH in that 6 to 7 range ideally. But I see test results when we're measuring the pH, and people's pH can be over 7, and even alkaline, like 7.3, 7.5. That's a great environment for parasites to thrive. And it usually means they're lacking the beneficial bacteria, which help to create that acidic environment in the gut. And so here are some of the other symptoms that parasites can cause, and they're not just relating to digestive symptoms. Things like itchy skin, joint pain, brain fog, sharp shooting pains throughout the body, muscle twitches, becoming more hypersensitive, symptoms like hay fever, chronic fatigue, developing an autoimmune condition, and changes in mood like anxiety and depression can all be caused by parasite infections. There's a big connection between the gut and the brain, and sometimes if mood changes have suddenly started out of nowhere, it could be because of dysbiosis like bacterial overgrowth or a parasite infection, and more testing will help you work that out. So I've mentioned the word testing and how to know if you have a parasite infection. But what's the best test to do? My favorites are either the GI map test by Diagnostic Solutions or the 𝗪𝗪𝗎 by Vibrant Wellness. Both provide super detailed tests. The Vibrant Wellness probably covers more parasites and more infections, as well as more of the beneficial bacteria levels. But both of them are excellent tests for analyzing and detecting parasites. Things like the more serious ones like Entamoeba histolytica, Giardia, 𝗪𝗏𝗏𝗏, and the common ones like Blastocystis, the 𝗦𝗶𝗴𝗏, 𝗦𝗏𝗏𝗏𝗏. These can all be detected by these tests. And the difference between these tests and some of the other ones out there is they can also show you the exact amount of the parasite. Some tests out there will just show if you're positive or negative. And you could be positive for a parasite, but at such low levels, it's not the main issue. And they may not be detecting the other bacteria. But if you have high levels of parasites and high levels of inflammation markers, this is a good clue that you need to treat these parasites. So markers like calprotectin, secretory IgA are all affected by infections that are damaging the gut mucosa. So you can order the GI map or the 𝗪𝗪𝗎𝗪 from the Planet Naturopath website, and we can ship these tests to most countries worldwide. This testing is not cheap, but testing helps to take out the guesswork. So sometimes people do, multiple rounds of different products, and they maybe just be treating the wrong thing. Having the results help to get a structured treatment planning process so that you can not just treat the infections, but get the overall gut health optimized to prevent future infections. This is why sometimes you'll have, a group of people go and eat the same foods. They might be, on holiday in Bali or Mexico. Sorry for picking on those countries, but they're common places to pick up infections. And one person gets really sick, but the rest are fine. But their gut health may have been, a bit more bulletproof compared to the person who got the infection that sort of overtook their system. Besides stool testing, you can look at blood tests. You're not going to be able to diagnose a parasite from a blood test, but often you'll see high levels of eosinophils in a blood test. This, of course, can be from allergies, hay fever, and many other things, but it's commonly associated with parasites too. If you have a lot of GI issues and you go to your doctor, sometimes they send you off for an endoscopy, colonoscopy, and these only look for structural issues. So you could have, chronic diarrhea, lots of gas, bloating, all these digestion symptoms, and you do a colonoscopy and it comes back fine. And you're told that, okay, you just have IBS, everything's fine. And these tests can be good to do, but they're just looking at structural things. They're not looking at, and they can't measure things like parasites or bacteria levels, whether you have good bacteria, bad bacteria. So there's a time and a place for these tests, but not for detecting parasites. So let's go through some of the common parasites that potentially you may have and what can be done about it. 𝗡𝘁𝘂𝗿 is often found in contaminated water from swimming pools, lakes, things like that, undercooked meat, raw milk. Diarrhea is the biggest symptom, but it can also cause inflammation and arthritic-like symptoms. Entamoeba histolytica. This is a parasite that's commonly found in countries like Africa, but it's actually one of the more serious parasites out there. And it doesn't always cause serious symptoms, but for some people it does. Once again, it can be from contaminated food, water, pets, and it can cause, severe diarrhea, liver inflammation, chronic inflammation of the gut, and it's one of the parasites that leads to and it's a parasite that has Entamoeba histolytica is a parasite that causes the most deaths out of any parasite. Giardia. This is another common parasite that can be found anywhere. It's from contaminated water sources, so it could be from lakes, swimming, camping, but also vegetables and lettuce that hasn't been properly treated could potentially have a Giardia infection. Blastocystis hominis. This is one of the most common parasites that I see that comes up in people's tests. It doesn't mean you always got to treat it. It can come from contaminated food, water. It's easily spread from person to person. And once again, you could be asymptomatic, but also diarrhea and abdominal pain is a common symptom. Treating parasites involves a combination of diet, because you want to try and create a more acidic environment in the gut and by promoting the right bacteria. So things like prebiotics, probiotics, but also foods like all your resistant starch, vegetables, fibers will all help create an environment that's unfavorable for parasites. Herbal antimicrobials like herbs that can be used to treat parasite infections include garlic. It's effective against Blastocystis hominis, but a wide variety of parasites. Wormwood, black walnut, golden seal, clove oil, thyme and oregano oil. And I wouldn't just use one or two of these, but some of the best antiparasitic formulas contain a combination of all of these products. Other things that can be helpful is mimosa pudica that can help bind and eliminate parasites, using biofilm enzymes to help break down the biofilms that parasites can create. So with diet, as well as eating things like, all your vegetables, lean proteins, fermented foods, coconut oil, which contains monolaurin, which can be quite antiparasitic, apple cider vinegar to help stimulate stomach acidity, papaya and pineapple for enzymes. You also want to avoid things like sugars and processed foods, alcohol, which can lead to leaky gut and more inflammation, any trigger foods that are flaring up symptoms. For some people, it's gluten, dairy, eggs. They can all be fine foods to eat, but when you've got an infection and inflammation, they can exacerbate the situation. So here's a step-by-step summary of what you need to do if you suspect a parasite infection. Do an advanced test like GI map or the gut zoomer to really understand if you do have an infection or if it's being caused by something else like lack of beneficial bacteria or overgrowth of a different type of bacteria like Citrobacter, Pseudomonas, Staphylococcus, Klebsiella. Have your results assessed by an experienced practitioner so you can get a structured plan and not just treat randomly. Optimize secretory IgA levels and reduce inflammation. Focus on diet, nutrition. Always treat infections like Helicobacter pylori first. This can lead to low stomach acid and create an environment for parasites to thrive. You want to make sure that these, treating from up down, treating H. pylori, optimizing stomach acid, stimulating enzymes and bile function, and then potentially treating the parasite. Use a combination of herbs, essential oils, biofilm agents. You probably need to treat for at least 8 weeks. And then as far as retesting goes, I always recommend waiting for at least a month after treatment, because these tests, they're looking for the DNA of parasites. You want to make sure all the DNA is cleared out of the system, even if it's the dead DNA from parasites that you've been treating. So once you've done a test, if you treat for a couple of months, focus on optimizing the beneficial bacteria and waiting at least a month or so before retesting. So these advanced gut tests like the GI map or the 𝗏𝗏, they're not just for testing and treating parasites, but any gut health problems, autoimmune problems, chronic inflammation problems, even things like anxiety and depression can all be connected to the gut. So if you've got these issues or digestion issues in general, doing an advanced stool test can help you take out the guesswork. You can order these tests from Planet Naturopath. We can ship tests to most countries worldwide. If you have any questions, leave a comment or contact us at Planet Naturopath. And just click like if you appreciate this video, and we'll make more videos like it.